speaking of SportsMed, you can like SportsMed SA on Facebook to keep up to date with all the latest news and information. And we would pop down there during the week and we caught up with a great team at SportsMed.
The hip can be considered as the foundation for the lower limb, so the bottom half of the leg. And so the hip has what we call the glutes, which is the biggest muscle in the body and the most important in controlling where our pelvis is in space and time. And when you walk, you take 1.5 times your body weight through that leg. And so the hip surrounding it needs to take the majority of it. Otherwise, the rest of the limb, so the knee or the ankle, will have to absorb that, and that can lead to further injuries. With our general population, a lot of the older population tend to have irritation of the outside part of the hip, which we call a bursitis, and also people who partake in labour type jobs.
One of the more common presentations we see here in the orthopaedic area of SportsMed is of arthritis of the hip. As people are ageing, then they can develop wear and tear in the hip with loss of cartilage, which can lead to a lot of chronic pain in the hip.
A lot of the hip injuries that occur with footballers are because of rotation or high load jumping landing. So they can get femoral acetabular impingement, so impingements of the hip, or they can get muscle strains of their distal leg, so the quad strain.
When players are reaching down for low balls, they quite vigorously flex the hip up and twist it in, and that can cause some impingement in the hip, which can lead to tears in the cartilage in the hip. One of the interesting advances in hip replacement surgery in particular is the development of more minimally invasive surgical techniques for the hip. Traditionally, hip replacement surgery was done through either the posterior approach or the lateral approach, both of which require some splitting and cutting of muscle, whereas over the last 10 years, better techniques have been developed to go through what's called the anterior approach, which is a less invasive approach through the front of the hip. It involves going between the muscles, and therefore patients have a bit less pain afterwards. They tend to get up a little bit more quickly, and there is a little bit of a lower risk of dislocation of the hip replacement afterwards as well. It takes approximately 6 weeks to rehabilitate following hip arthroscopy or hip replacement. One of the great advantages here at SportsMed is that we have a close liaison with our physiotherapy colleagues who can assess the patients both before the surgery and after the surgery and help with their rehabilitation to get them moving more quickly.
As you can see, they're absolutely world class. They can sort you out with whatever you need and get you back to being you with SportsMed SA. For a free copy of SportsMed SA's Health and Wellbeing magazine, you can email pr@sportsmed.com.au.